World of Wellness, and welcome to the Wine of Wellness Week number 97 as we rapidly approach Wine of Wellness Week 100, which should be this year in December. So this is our spring event. We are open until 7 p.m. tonight. You do not need to be a patient. You do not need to have an appointment. All you do is come down. We're open till 7 p.m. tonight, 2419 Baldwick Road, right in the heart of Pittsburgh, PA. We have free, healthy, organic food for you to have. You can take it with you or eat here. We have workshops going on throughout the day and throughout the week. We have demos, free zyto testing, massage, smoothies, literature, education. And if you want to buy anything, we have deep discounts. So you can join us live with the event. You can also join us with the streaming or pick up the recording. In addition, if you want to order anything, you can order right through our website, or you can call the office, 412-922-WELL. That's 412-922-9355. Come on down. If you come down today, you get a free sample bag valued over $50, Phil. Get your free samples today. All types of great free samples. Come see our nurse at the front desk, Kylie, giving out free samples today. So thanks so much. I'm so excited. We finally got him back. This guy is an industry expert. He's learned more about the industry than most people ever have. He was involved way back in the 90s in sports nutrition, and he's been a really important part of my career in helping functional medicine doctors implement nutritional protocols really to improve patient outcomes. He's been working with the leading mineral company in the world, Albion, and now they're Balchem. So let's give a nice warm welcome to Rick Harnish. Welcome back, Rick.
Jamie, how you doing, buddy?
We are excited to have you back on. I see you relocated from Miami Beach to Northwest Florida. How's the transition down there? Looks like you got the fishing poles out. He looks very relaxed. I'll tell you what.
Those are my fly rods. So yeah, actually I moved from Jupiter over to Homosassa, which is about 50 miles north of Tampa, and I came here for the fishing.
Oh, well, you know what? You must be a passionate man. I can't wait. It looks like you have more than one pole there. So
I've got 10 fly rods on the wall there, and then in my garage I've got 2 boats, a bunch of tackle, a bunch of rods. I just recently got my captain's license, so my next pathway in life is going to be taking people fishing and earning a living from it. So.
Well, hey, now I love when they take me out in those boats, Phil, because, you know, these guys do everything. They got the boat, they got the rod, the reel, the bait, the whole deal, and they always catch me fish. So I'm excited to reconnect with you down there. Rick, before we get in about Albion Minerals and the covalent bonds and everything, give us a little background on you and, you know, what you've seen in the nutraceutical industry, because we've both been in it before the Shea Act, and it's really has the transformation has been incredible to look back on.
Well, I've been in the industry for 32 years. I got started in sports nutrition many years ago, and I dealt with sales. I dealt with developing the professional sports market. I used to sell products to Major League Baseball, NFL, NBA, hockey teams, you name it. I did many studies with different universities on the advocacy of the sports supplements that we were selling, and I had some great relationships in that market. And then from there, I got into contract manufacturing, which you do with many of those types of customers, entities. And then I've been with Albion for 22 years, and we were purchased by Balchem 6 years ago. So it's been a journey.
Wow, 6 years already, huh?
Yeah.
And Rick is one of the pioneers for people like myself that were working out in the 1980s. Rick was part of the team that launched Hot Stuff, I believe.
Exactly.
Right? The original shake that people were really got people excited about supplements. And then you've been with Albion now and Balchem for 22 years, a fantastic career. And this guy really has a well-rounded background, because a lot of us started in sports nutrition. Not all of us were so lucky to get out of that into more of the functional side, because, you know, the opportunities are so much greater for us to work together. So tell us a little bit about Albion and what's so different about you guys.
Well, Albion is a pioneer. Albion as a company has been in business for, gosh, how long have we been in business now?
Long time.
66 years. 66 years Albion's been in business. Albion started out as a veterinary pharmaceutical company. Dr. Harvey Ashmead started the company. He left Pfizer and the opportunity to be president of Pfizer to start Albion. And so Albion's whole key was veterinary pharmaceuticals, and eventually it grew into research in the field where they realized that the animals, particularly livestock, were deficient in nutrients. And so he developed, at the time, what was a crude chelate.
Rick, I'm sorry to interrupt you. It seems like there's some audio on your end.
Let's see here.
On the speaker.
Let's see. Can you hear me okay?
No.
Okay, I don't know what's going on here.
You want me to log off and log back on? Yeah, if you don't mind just logging off and then coming right back on, we'll try and get a better connection.
Okay, let's see what we can do there.
Thank you. Also, the PowerPoint's not advancing. Okay. Okay. There we go. Cool.
Can you hear me now?
Much better. Okay, so.
Okay. So getting back to Albion, Albion's been around a long time. We're the pioneer of chelated minerals. They were developed to enhance the absorption of minerals, starting with animal nutrition, and then we have a foliar division, and then human nutrition. So we basically cover all aspects of mineral nutrition, from food you eat all the way to personal supplementation.
And when you mentioned, the word mineral chelates, can you give a very simple definition? Because sometimes people think of chelates like chelation therapy, then they hear amino acid chelates, but most people it's a little confusing for them.
Well, chelation therapy is a method of taking toxic heavy metals out of the body. So what we do is we created a chelate structure where you have a mineral that's bound to an organic complex like an amino acid. In many cases, it's glycine. And the whole idea is to stabilize that mineral so it goes through digestion, does not ionize in the stomach with dietary proteins, fats, or carbohydrates, gets through into the intestinal tract where your nutrients absorbed, and gets into the cells, into the bloodstream via that manner with minimal interference.
So I've been told in the field that a lot of companies will take something like, say, magnesium and glycine and mix it, call it amino acid chelate. But your company, Albion, is actually a leader. You guys do covalent bonds. Could you explain a little bit about that process?
Yeah. So what happens here is to have a chelate, the mineral's got to be a divalent molecule, meaning it has to have 2 electrons. So it's, if you look at the picture on the screen here, you got N, which would be the mineral, and each of those chains, with the oxygen, the hydrogen, and so forth, carbon molecules around there, those are the amino acids bound to the N, which is the mineral. That's a chelate structure. So you can't just take a mineral salt like a mag oxide or a calcium carbonate or a zinc sulfate or whatever, blend it with glycine and create this structure. You have to have an actual reaction. So what we do is we start with a soluble mineral salt. So there's 2 parts to the mineral. You have the ion, which is the mineral itself. That can be calcium, magnesium, zinc, copper, iron, whatever. And then you have the anion, which would be a carbonate, a sulfate, an oxide, or whatever. And we dissipate that anion. So what we have in solution is a free mineral. And then we react it with the amino acid glycine. And glycine is the one we use predominantly because it's very low molecular weight. So total molecular weight of the finished chelate structure has to be below 800 atomic mass units. If it's larger than that, then as it's absorbed and goes through the stomach, body's going to try to break it down to make it a smaller molecule. So large molecules have a hard time being absorbed. Small ones that are smaller and more stable are better absorbed, and that's what our chelate structures are.
And that's why we have made the choice to work with you guys exclusively, because of you and your team at Albion, because these are different. These are part of our PRTs, our patented research trademarked ingredient. So anytime you see Albion on the logo, Balchem, or TRAX, which stands for the real amino acid chelating system, and have the confidence now that these are covalent bonds and without getting into the deep biochemistry, that means your body's going to recognize it and absorb it like a protein, and you'll get significantly better digestion, absorption, and assimilation. So that's why we work with it, folks. So there is a difference in nutraceuticals, just like any other field. You get quality at different levels, and that's why we like Albion. So here's some of the things you guys have done over the years. Maybe you want to share some of the highlights.
Yeah, I mean, Albion's the only company that's gotten any intellectual property on chelated technology. We've achieved over 150 patents worldwide. Also, many of our mineral chelates are on the Chemical Abstract Service Registry, which is commonly called a CAS-RN. Of course, all of our chelates are kosher and halal certified, and everything that we've done has been chemically validated. And then all the research that's ever been done on the chelated mineral has been ours. We haven't seen anybody else put any research out on what they claim to be a chelated mineral.
Yeah, so they are head and shoulders above any other minerals out there. There are a lot of generic minerals you can get. However, when you want the most bioavailable, and why wouldn't you want the most bioavailable? And it's not just the amount. I think that's something that gets questions a lot in the field, is the amount of the minerals versus the absorbability. So can you comment on that? Because I know you can get a lot more mag oxide in versus mag glycinate into a capsule, and sometimes people just look at the amount.
Yeah, they look at the amount, and there's different percentage of elemental values of minerals. Like mag oxide is 52%, and our best magnesium is only 10%. But the absorption characteristics, which you'll see in the slide further on down here, for what we have is a lot better. It's almost 3 times better than what magnesium oxide is. So, the oxide is a mineral that's a mineral salt. It's going to have a hard time being absorbed. It's going to have low bioavailability. And the majority of it's going through passive digestion versus active absorption, which is the method that Albion chelates are absorbed by.
Yeah, so this is an overall chart that Rick created that shows the Albion amino acid chelates. Bioavailability, excellent, very good. GI tolerance, very good. Safety, very good. When you start to get into salts, so those are going to be like calcium carbonate, right? So when you get into these mineral salts, very to poor, maybe adequate bioavailability, tolerance, and safety. So when you go down the list here, most of them you see do not have the great bioavailability, tolerance, and safety. So the only one you're going to guarantee that with is actually the Albion really chelated minerals, right? So there's a big difference on these. So you back on, Rick?
Yes.
I think we got to maybe ask you, have you recharge again? I'm not sure why the
connection. Can you hear me now?
You still there?
Yeah, somebody on your side muted me, so.
Yeah, it's you need to reboot. I'm sorry.
So do I gotta shut down and reboot again?
Yeah, I'm sorry.
All right, let me do that.
It sounds like a typewriter or something, right?
I'm clicking right now. All right, hold on.
All right. Oh, we're just getting going. Must be the speaker or the room. All right, have a good one, buddy. Thank you.
Okay, you there, Jamie?
All right, third time's the charm. So we'll pick the pace up a little.
So anyway, in regards to Albion minerals, what makes them successful? They have to be under a certain molecular weight. You want to go back to the other slide?
Yeah.
Okay, under 800 atomic mass units or 800 daltons. They have to be electrically neutral. So here's the thing people don't understand. Mineral salts, because they're divalent, but they're not stable, you've got 2 electrons there. So that's how they interfere with food, and dietary absorption is compromised and so forth. They've got to be stable. They have to stay intact through the gut, through the stomach, which is very acidic. And the ligand, which is an amino acid, which is the simplest form of protein, has to be easily metabolized. So basically what we're doing with the chelate was we're making a dipeptide mineral amino acid chelate structure is what it is.
Well, I love it, because there's no shortage of minerals out there, but nobody providing the type of quality assurance that you guys are. And I think what comes up a lot is, well, how come you can get 100 milligrams of the maybe magnesium bisglycinate from Albion versus 500 deoxide. I think that's what really this is showing right here, right?
Well, what this is showing you is nutrient density. So when you look at a mineral, like for instance, if you look at a calcium carbonate is 36% elemental calcium. The rest of it is carbonic acid. So the nutrient density of that is only 36%. The body is not going to use that carbonic acid. Zinc picolinate, you have 21% zinc, 79% picolinic acid. The body's not going to utilize that picolinic acid, so the nutrient density of that is only 21%. When you look at a chelate, and this example is for zinc, the zinc elemental value is 20%, but then we've got 69% amino acid, which is glycine, and then we have some residual water, H2O, at 11%. The body is going to use each one of those three components there in the zinc amino acid chelate or zinc bisglycinate chelate, which equals a 100% nutrient density.
So it'd be safe to say you can look at the zinc amino acid chelate as a whole component versus the other one, the body's just going to absorb the zinc?
Exactly, yeah. Yeah, the only value in the picolinate in this case would be the zinc itself, not the picolinic acid.
I love the way you describe that. That's very helpful and appreciate it. So we get into more of the mineral deficiencies. Of course, what are some of the things that affect the absorbability?
Well, dietary protein is number one. pH is very important. If the molecule is not the proper pH, it's going to get compromised. All of the chelates that we make are more on the alkaline side, with a pH around 8, anywhere from 8 to 12. Whereas you're looking at 6 is neutral, anything below 6 is very acidic. You definitely don't want something that's acidic. Precipitating anions such as phosphates, phytates, oxalates, fats. Phytates and oxalates are in vegetables and grains. They do block the absorption of minerals. So if it's a mineral solid, it's going to hinder that. And then, of course, mineral competition. Minerals, as they go through the journey through the stomach into the intestinal tract, are all trying to compete for absorption. And some of these try to compete at the same mucosal site. And the reference to that would be like going to the circus and seeing how many clowns you can fit into a car. You know, that's kind of how that is. So albumin minerals are designed to absorb at different receptors through the intestinal tract, kind of like going up in a high-rise building that's 50 floors and the elevator stops at each floor. Well, that's how the albumin minerals are absorbed. They're at different floors versus all trying to get into that car to get into one location.
Is that why they need to be in specific ratios, right? Sometimes you see a mineral and it's got, 100 micrograms or milligrams of everything across the board, but you always recommend to put them in the right ratios.
Well, the ratios and formulation are pretty much based on the RDIs. It depends on what you're trying to achieve with the product. So, I mean, I look at things like calcium and magnesium. You see that commonly in bone formulas. Right. I think the ratio should be the other way around. It should be 2-to-1 magnesium versus calcium.
That's what we did with our magnesium complete powder by Nutritional Frontiers. We've reversed it based on your recommendation. A couple of our doctors are like, people get enough calcium, it's getting congestion. In magnesium, it seems to be right along with fish oil, probably the top 2 nutritional deficiencies that we see.
Magnesium activates 300 metalloenzymes in the body, so it's very important for the utilization of all nutrients, and it's what helps calcium convert into bone.
So just overall, what are some of the benefits of all these different types of minerals?
Well, take a look at this chart here. If you look at the different systems in the body, the first one being the immune system, copper, zinc, iron, and selenium are very important for immune health, and we've had a tremendous sale of those products the past 3 years. They're all steady, but with the COVID situation, people wanting to maintain their health and make sure they have adequate nutrients in their body, we've sold tons of those products. Energy production, magnesium, phosphorus, manganese are all important for that. Hormone regulation, iron, manganese, zinc, copper, and magnesium and potassium are important for that. Vitamin production, cobalt, which you get in your vitamin B12, methyl or cyanocobalamin, that's where that comes from. Blood, you got copper and iron. Enzyme systems, zinc, copper, potassium, manganese, magnesium, iron, calcium, and molybdenum. And then, of course, skeletal system, bone health, you got calcium, magnesium, zinc, manganese, boron, phosphorus, and then for reproduction, Very important. You've got phosphorus, copper, potassium, manganese, zinc, and magnesium. So for all the life systems, that the body has and needs that they have, minerals are very important. You can't go out and buy a multivitamin formula with no minerals in it, because the minerals are what activates the vitamins and make them work in the body. So it's very important to have a good combination of both. Or in the case of different systems in the body, like for instance, bone health or reproduction. There's a lot of people that take a multivitamin. I tell everybody your day should start with a multivitamin. That's the heart of your nutritional program. But if you're in childbearing years, you probably need to take a prenatal in addition to that. And you're definitely going to want to take a bone health product that's going to give you more nutrients that you're going to get that multivitamin and mineral.
It's not fast forwarding now. Yeah, it's interesting because, Dr. Weiner was a well-known natural healer for 50 plus years in the Pittsburgh area. And, even though he carried upwards of 1,500 different products in his health food store, minerals were always near the top. Magnesium was 1 or 2, and Ftir Minerals right the same. So he was a big believer in the multivitamins and minerals. And, oftentimes people would come in with pain, muscle cramps, fibromyalgia, blood pressure, diabetes, so many things. And he would say minerals, and people would be like, that's it?
Yeah.
He's like, well, we start there because you're deficient in minerals, because you're having leg cramps, you're having inconsistent menstrual cycles, you're having migraines and headaches, you have elevated blood pressure or blood sugar. So sometimes I think the best solutions are right there, but people may not realize how important they are. So maybe, you want to talk a little bit overall about a comparison of the minerals. Which ones do you need at which dose?
Pretty much, everything in regards to the RDI is what you're looking to do. There's different testing methods out there that you can do through your wellness center, that you can monitor a patient's level of nutrition right now. One of those is SpectraCell, which is a blood draw, and what they do is they run it through a system. Takes them 24 to 48 hours to do it, and they come back and they'll give you a printout of what your nutrient levels are based on what's in your white blood cells. And so we have
a couple of we have a few options here at the World of Wellness. So folks, you want to come down, this is the Wine and Wellness Week number 97. I'm your host, Jamie Dorley. We have world mineral expert Rick Harnish, who's been working in the field of nutraceuticals for over 32 years. Very generous with his time. He currently works for the past 22 years for Albion and Balcom. And what Albion is the leading company in minerals, and especially their tracts, which is the real amino acid chelates and their chelating complexes. So we appreciate having him on here. And at the World of Wellness, you can come down today. We are having our event. So we have healthy, free food going on until 2 p.m. today. We have 5 workshops per day. We have free smoothies in the bar. Is the bar open? The bar is always open. Good answer, Phil. So come on down, folks. We're having fun today. If you buy anything, everything's on deep discounts. And we do have a couple of options for testing. Rick had mentioned SpectraCell, which we are partners with. We also have in-house testing with Ftir Scan, which actually tests cell composition of minerals, toxicity, antioxidant, and vitamins. Plus, we have the Ftir Scan, and we also do applied kinesiology. So we have options for you depending on where you're at and what we need to test you on. So we've reviewed this a little bit earlier, Rick, and I think this is going to become a poster program for us because, a lot of people don't realize that there is differences not only in the dose, but I always say that the other most important thing is the form of the nutrient. If these minerals are bound to some type of salt, I consider it like a rock, like calcium carbonate, poor bioavailability, poor GI tolerance, and poor safety. So the question always comes up, well, why does a company have those if they're poor? I said, well, there is cheap vitamins too, just like any other field. So what's some of the other things on here you've seen that you would throw caution to the wind at?
Well, the most important thing is to understand toxicity levels. Everything has a toxicity level. We've done what they call LD50s, which are basically rat studies where You find out what the safe upper limit of the animal is before they die. LD is lethal dose at 50%. So once it gets to a 50% label, then we're able to extrapolate that into a safe level of minerals based on, per body weight of the human body. So everything out there has got a safety evaluation to it, even the salts and everything, they all should have LD50s to them. But the most important thing is understanding that you're getting better bioavailability with an albumin chelated mineral. You've got very little and very low GI intolerance. If you can understand how a mineral would create GI intolerance, it's like taking your fingers and scratching them on a chalkboard. Okay, that's kind of like a mineral, the brush border running against your intestinal tract that some people get, irritation with that. And magnesium, iron, and zinc are predominant in that. With zinc, if you take a look at cold and flu season where people take zinc lozenges, if they take a lot of those, they're going to get an upset stomach. So that's kind of like the fingers on the chalkboard there. Albumin minerals being a dipeptide, they're more gentle, they're better bioavailable, they have a better safety rating. So there's a big difference in minerals out there.
It's a great chart. We're going to like to help educate people on that. So you talk about LD50, so that's a dose that would kill 50% of the mice or more?
Yep, yes. LD stands for lethal dose. So when you take a look at here, we're looking at soluble salts versus an albumin amino acid chelate, a mineral. The first one is copper, second one's iron, third one's chromium, manganese, and then zinc. And you can see in all these instances that the tolerability of metal per kilograms of tissue is a lot higher with a chelate versus a mineral salt.
So this is comparing the albumin chelated minerals versus generic mineral salts and the safety of those minerals at significantly higher dosages.
Correct.
Yeah, it's an important factor because I think a lot of people look at the vitamins, even our most loyal of clients, not this guy, of course, right? He's very loyal to us, but people do come in and they bring some of their vitamins in, and I think they're very disappointed when we show them the labels. Someone came in the other day and it was a well-known company, Nature's Sunshine, and we looked at the label. They're using cyanocobalamin. They're using zinc oxide.
Yeah.
So when you talk about the irritability of the intestinal tract, now that's known as a good company, right? What about the companies that are known for being bad? I mean, folks, you got to do your homework, and that's why we do all these workshops so that you become informed, educated, empowered to make the right decisions. And whatever your budget is, if it's $20 a month or $200 a month, we can point you in the right direction so that you get the best quality of nutrients you get in. Because one is we want you to get the best results, but two, most importantly, we want it to be very safe. And when you talk about irritating or scratching the intestinal tract, no wonder. I mean, the intestinal tract's under just duress as it is, with all the stress people are under, the toxic food, the antibiotics, and now potentially toxic vitamins. So what about the absorbability of these calcium sources? Because that's the other one that comes up a lot is, well, how well is it absorbed?
Well, this chart here kind of gives you a snapshot of different forms of calcium. And what we're looking at is the last column here, which is fractional absorption without a meal. When you take it with a meal, absorption may be improved a little bit, not much. But when you look at things like a calcium hydroxyapatite, which is basically bone meal, that's really only 16-17% bioavailable. When you look at calcium carbonate, it's 23% bioavailable. When you look at calcium citrate, it's 24%. So it's not much better than carbonate, but it's a much more expensive nutrient. And then when you look at the calcium bisglycinate chelate at the bottom there, we have a 44% bioavailability. So that just shows you, when it comes to calcium, that you're getting a better absorption with an albumin mineral. That's going to enhance your benefits.
Yeah, it looks like more than twice as bioavailability as some of the calcitrates and carbonates, and as much as 3 times more bioavailability than the hydroxyapatite, which has been promoted as the gold standard, actually. But now we're learning maybe it's not.
Well, the whole thing when you're looking at nutrients too is when I did contract manufacturing, and I formulated thousands of products in my years with customers, I would say to them, what type of product do you want to have? Do you want a food, drug, and mass product that's really going to be cheap, like a Centrum? Do you want a retail health food product that may have some branded good quality ingredients in there? Or do you want a practitioner brand that is relying on science like Nutritional Frontiers to bring a product out to their patients and customers? What are you looking for? And they would tell me, and usually if they told me they wanted the cheaper one, I'd say, okay, you own the company, you're selling these products, are you going to take these supplements yourself? Oh yeah, I'm going to take them. I'd say, well, why don't we work to developing you a better quality product then? And 8 times out of 10, they would agree with me. So when we're looking here at, go ahead.
No, I was just say with your experience, at least helping the customer at a higher level, be aware that, hey, there are some other options you can go. But we get the same thing. People come to me for help with a custom formulation, and they have this price point in mind. This is, we can get to that price point, but you got to change the product. And when they say no, I said, well, you came to the wrong guy, because nobody can do it for that price point with the quality.
Quality has a price, of course. So what we're looking at, go back to the last slide. This is interesting so people understand calcium absorption again. This kind of illustrates it, as a chart. Calcium carbonate. Milk calcium is 27% bioavailable. So, the old commercial milk does your body good is actually got some truth to it. Of course, our chelate at 44%, and then citrate and hydroxyapatite at 25 and 17. So you can see that right in the middle, the albumin chelate is the best source of calcium.
Yeah, and it's significantly better. I mean, it's almost double in some of them. It is double.
Yeah.
And then it's right across the board with zinc, very consistent as the last one.
Yep, and the most common forms of zinc that we see out there are citrate and zinc percolonate. And you can see that the albumin zinc bisglycinate chelate is superior in absorption to those other 2 forms. Likewise, magnesium. Here we have magnesium bisglycinate chelate. We have magnesium carbonate, we have mag sulfate, and we have mag oxide. Mag oxide is the highest elemental value at 52%. That's why a lot of companies use it. It's a very small dosage, whereas our material is a 10% elemental. You're going to have a larger dosage, but you're also going to get more bioavailability.
So what that means is the amount we can get of the mag albumin bisglycinate chelate, we're not going to be able to get as much into a capsule. That's what you're saying, correct?
Yeah, and typically your multivitamins and minerals you're not going to get 100% of the RDI nutrients in there. There's just no room. They would have to take 12 to 14 capsules a day. They're not going to do it. But if you take a look at this and say, okay, let's formulate this based on bioavailability. The RDI for magnesium now is 420 milligrams. But if you had 260 milligrams or whatever, just throwing that as a number, not an actual calculation, of magnesium from magnesium bisglycinate chelate, you would have more bioavailability at that lower elemental dosage than you would have that higher RDI dosage of mag oxide.
Yeah, and this looks like the magnesium, 87% bioavailability. That's incredible.
Yeah, it's 87 based on parts per million. Magnesium is one of the tougher products to analyze because it's stored in bone and soft tissue, and most of the other minerals are more readily available in blood serum.
Interesting. And the same thing consistent with copper absorption, because a lot of people say, oh, why do you have copper in the products? It's really hard to absorb. It affects thyroid, it affects all these things. I said, well, it's a mineral. It's an essential mineral.
It is an essential mineral. It's very important for immune health also, and also for soft tissue, cartilage, anybody that's got knee surgery or anything where soft tissue is involved. Copper, zinc, manganese, selenium, they're all important in that aspect.
Yeah, and can you comment a little bit on the toxicity? I'll give you an example. I was down in your old hometown, Southeast Florida, right? And I was meeting with an acupuncturist, and she says, I don't want any copper in anything. I said, okay, well, why is that? Oh, I've been told I have copper toxicity. I says, okay, well, it wasn't from our product because you never took the product. So where was the copper toxicity? I'm not joking. The next appointment I went into, Dr. Elizabeth Tringali, she says, you need a little copper in your thyroid product. So, those are 2 healthcare professionals, right? The consumers, it's even more divided. So can you talk about possibly maybe the sensitivity, and maybe that's from a poorer form of copper or too much?
Yeah, it's going to be the poor form of copper. But copper in general, there's some interactions there, nutrient interactions that may cancel it out, or copper may cancel something else, like copper and iron. seem to be antagonists. But, with the chelate structure being a dipeptide, and in the case of our copper being used with Ferrochel, which is our flagship iron and the best iron on the market, that's a chelate structure. There is really no dietary interactions between those two because, again, they get absorbed at different sites along the intestinal tract. They don't compete for absorption.
Well, that's a great point. We've had incredible results with our Women's Complete. It has 7, take care, buddy, 7 patented research trademarked ingredient, including a host of different of the albumin minerals, including the Ferrochel, which we were actually able to reverse for a young woman. We're not making any claims here, but she was pregnant, late 20s, and she presented to the doc that she was really tired. Blood work supported that she was anemic. The doc put her on prescription iron oxide. She had severe constipation and GI distress. She was actually good friends, with Candace that works with us.
Yeah.
And Candace says, well, hold on a minute. Let's get you on the Woman's Complete. Just from the Ferrochel in the Woman's Complete, in 6 weeks, anemia gone, fatigue gone, and supported by symptoms and blood work, just by that extra iron in the Woman's Complete.
So the fact that she had intestinal issues with the iron oxide, again, is the fingers on the chalkboard.
Yeah. Well, and that was proven, and it wasn't like we just put her on like something like our Easy Iron. So, folks, when you work with the right ingredients, especially in nutraceuticals, your results and your safety are determined by it. And what Rick here is an expert in not only the nutraceutical industry, but specifically with minerals, but I've been working with albumin for over 22 years. That's unheard of, Rick, in this day and age of everyone jumping ship so quick. So that's to be commendable. 22 years at one company. You've been there through all the research and transitions and acquisitions, and he's really played a big role in product development for us because he's been so generous with this education, and it's greatly appreciated. So this looks like calculated total absorption from various sources.
Yeah, this is chromium. A lot of people don't really understand chromium. It's really good for carbohydrate metabolism, blood sugar, and so forth. But you've got different sources. Chromium chloride is more of a clinical setting. That's something that hospitals would be predominantly using. Then you've got chromium perchlorate, you've got polynicotinate, then you've got our chromium nicotinate glycinate chelate. And as you can see here, based on absorption characteristics of the chromium, again, the albumin chromium is better than the other 3.
Yeah, and you had mentioned chromium, a key nutrient. Throughout the years, I've been tested on chromium. It usually is at 0 or very low, which correlates with my blood sugar challenges, right? And when I was first getting into supplements in my late teens, early 20s, I tried a chromium product, and I was shocked at how well it worked for weight loss, pumps in the gym. And I look at it, correct me if I'm wrong, as almost like the transport of carbohydrates inside the cells so they can get better burned as energy versus being stored as body fat. Is that accurate?
Yeah, that's accurate. And another thing that's really overlooked, because it doesn't have an RDI to it, is vanadium. And vanadium.
Oh, you read my mind, Rick.
I've got a retired. He's just retired 2 years now, but he's a good friend of mine. He's a pediatric endocrinologist in Altamont Springs, Florida, and he's developed some really good products for his patients. And he's reduced the amount of blood sugar issues in a lot of these severely diabetic kids that are on the verge of losing eyesight and things like that. And his magic ingredient in this formula is a high amount of vanadium.
How high?
He's got as much as 1 milligram.
Wow, because I remember the old days. Remember the Sports Farmer products, right? Vanadyl sulfate, the little blue pills.
That was an amazing product because
7.5 milligrams.
Yeah, one of the girls that worked there, Pia Igeman, she was a competing bodybuilder, and I was working for Hot Stuff at the time. I was in Las Vegas. She sent me a whole case of that Sport Pharma vanadium. And I had a friend of mine in Florida that was taking it. I said, well, what do you think? He says, I don't know, but my workouts, I have so much energy because the vanadium is very important in utilizing carbohydrates. So if he was carb loading during the day, pasta, potatoes, things like that, before going to the gym after work, that vanadium kicked in and he utilized those carbohydrates and that blood sugar. And so she sent me a case of that. I tried that and I was just blown away by it.
I would use one of those with one chromium with each meal 5 or 6 times a day.
Yeah.
And nothing like it. So I'm interested to be interested to talk to you more about looking at a formulation like that with higher levels of a couple key nutrients to really drive that sugar in. So we're here looking at chromium in the blood and the different I guess this is bioavailability and absorbability.
Yeah, so you can see here you got chromium chloride 1 and 2 hour draws. You've got chromium perchlorate, and then you've got our tracks chromium nicotinic glycinate chelate. And so what you're seeing here is that at 1 hour we have 37 IGs, and we have got 45 at 2 hours. So it just goes to show you that there's more retention and more bioavailability of our chromium versus the other forms.
Yeah, so it's talking about how perchlorates are absorbed but not really metabolized, meaning they absorbed into the blood but not driven into the cell.
Well, that goes back when you look at that slide that was on nutrient density where I talked about zinc perchlorate,
Oh yeah,
where it was 21% elemental and the rest picolinic acid. The picolinic acid really doesn't have any value to the body. It's just it's a ligand. You can create a chelate with it, but it's not 100% nutrient dense.
so that's the slide there. So the way I interpret this is the zinc amino acid chelate. That's a whole molecule. Your body's going to utilize all the nutrients, the amino acid and the zinc, where the zinc perchlorate, the picolinic acid is just not going to be utilized, right?
Exactly.
Well, this is very interesting. I'm learning a lot after 30 years. Great thing about our field is you're constantly learning. And I thought I knew minerals, but and here we go. Mineral interactions. Just when I thought I was feeling comfortable, Phil, we were on our way home. He throws this one at me. So let's hear it because Doc always talked about, magnesium has 300 biochemical reactions and, calcium has this. And he said it's a web. It all is connected. It's not just one nutrient.
Well, what it is, and this is particular with the mineral salts. Anywhere where you see a line, like for instance, we talked earlier about your doctors regarding copper or no copper. You'll see a line from Cu at the bottom to Fe at the top. It's not highlighted, but there's a line, so that shows there's an interaction there. Again, the ones that are colored, you've got zinc and iron, you've got calcium and zinc, you've got phosphorus and calcium. There's a lot of nutrient interactions out there in supplements, more particular when they're mineral salt forms versus when they're a chelate.
So some simple questions evaluate albumin, chelates versus, I like this one here. So are the minerals truly chelated to amino acid or just complex with amino acid? And that's what I was asking earlier, because when I asked that question to other vendors, they says, oh no, it's an amino acid chelate. I said, is it a covalent bond? They usually don't know, or they guess that it is. So
Yeah,
that is still going on.
You can't blend a mineral salt with an amino acid and create a chelate. That's what we call an admixture. Hydrolyzed proteins have a range of amino acids in there, as much as 20 amino acids. But the one thing about hydrolyzed protein, that can be a vegetable protein source or rice protein. All they're doing is doing a dry blend, or it's an admixture. It's a mineral salt with the salt anion being present where we take it out, mixed in with the hydrolyzed protein. And one thing about hydrolyzed protein, when they hydrolyze the protein, the glutamine amino acid converts to monosodium glutamate. So why would you want to take a product with MSG in it?
Learning a lot. So does the product have stability when subjected to various pHs? So a lot of people are acidic. The stomach is actually acidic. So do some of these products out there not absorb at these different pHs?
Well, the thing is like I said, the albumin minerals are alkaline. I mean, they're anywhere from a pH usually 8 to 12. So they don't have the acidic component, which is going to be pH is less than 6, anywhere from 1 to 6. So very, very important. Acid is very destructive. And a lot of companies that we have doing food products like juices that want to add chelates in there, we tell them you have to pay attention to the pH of the product. Because the more acidic you make it, if you're going to add additional citric acid versus what's already contained in there, that may compromise that chelate. And if it does that, then you're putting a really good ingredient in there, and you're not making it, optimizing its use.
I love number 3. So a lot of these minerals you talked about, the molecular size is too large to be absorbed, where the albumin minerals molecular size is very small, so it can actually be absorbed, assimilated in the cells, and actually do something. I love that. Not a whole lot of data going on from any of these other companies. I've been to all the trade shows. Albion is without a doubt the gold standard of minerals, and we've been working with them a long time. And then the last part, can you comment on this? Peer-reviewed research validating the safety, effective use in chelated minerals. I heard you a few times mention LD50s and different research that you guys have done. Over 150 patents. I mean, you guys have the incredible amount of research and support behind you.
Yeah, we've done all the studies. We've made sure that our products are safe with the LD50s. We have cash registration numbers on many products. We've done all the due diligence we need to do to make sure our products are safe and they're effective for patients and consumers.
Yeah, and this is what we talked about quite a bit. I'm going to really stand on top of the mountain and scream about this one for a while, because it's disappointing. Even my colleagues in the field, some of which have been working a long time, claim they manufacture these chelates when in fact, prove that they're not doing it. Also, not going to name any names, of course, but there are some large companies that have been sold in the field of nutraceuticals and in our industry. And then lo and behold, do they increase your product line or do they eliminate it? I mean, I've seen some of them actually eliminate your minerals from their products, and people don't even know. Very disappointing.
There's a lot of bait and switching going on out there, and a lot of the cases it's based on price. I mean, listen, in the world that we're in right now with inflation and gas prices being 3 times what they were, 16 months ago, everything's going up in cost. And some people, unfortunately, will cheapen a product, or they'll reduce the serving size and charge you the same or more money for it just to maintain that profitability. But everybody's got to realize that if you're buying something a year and a half ago that cost $20, that real cost today may be $24, because a company's got to survive. Everybody's got to be profitable. If you can't make money, you have no reason being in business.
Yeah, and I think the key is that we only raise prices when we have to. We've been approached by a lot of different companies to dilute the protein, do a protein blend, cut the serving size, all these different manipulations. We've decided not to. We make modest price increases when we can, but we feel, especially when you're ingesting something into your body, you need to make sure you have the quality control standards and the values at the top level, because this is people's lives at hand. We don't want to contribute to the world of toxicity people are already living in. And hey, you're spending your hard-earned money. You should get what you need to get the best, rather than just trying to get the cheapest. So we're talking about here the comparison of the amino albion's calcium amino acid chelates and company G's.
Well, if you go back to the previous slide, let's look at that one first.
Yeah.
Okay, so what this is an FTIR scan. We developed a patented method using FTIR to validate chelated minerals. So what you'll see here is and this is basically what you would consider a fingerprint. We have a lot of our manufacturers that buy product from us that use FTIR, where they're basically sticking a wand in some powder and they're drawing a spectral reference from it. And what they'll do is they'll make sure that their reference overlaps our reference. That's a lot of ways companies are validating products now. It's a fast, cheaper way to do it, aside from the initial outlay of the FTIR equipment. But this here, it's our calcium bisglycinate chelate 18% in comparison with another company's so-called chelate. And what you see here at the 1500 number is CaCO3, which is calcium carbonate. So what this is telling us is all they're doing is it's a blend. It's a dry blend. It's a calcium carbonate blended with a glycine, and they're calling it a chelate. It's not a real product. So this FTIR technology, which took us 3 years to do trial and error on it, we submitted to the AOAC for validation. So it's been third-party validated, and we use this regularly in the identification and validation of all of our products.
Well, that's some really unique and cutting-edge technology, and we're glad that you guys are, going to those great lengths. I mean, 3 years and the amount of resources you have to pump into something like that is no small feat, so we appreciate it.
That's definitely testing multiple lots of product over those 3 years too. You have to get a consistency before you can, get any intellectual property on something. So in this case here, we're looking at our chelate versus company G's. Our ratio is 2 to 1. So the ratio of a chelate is 2 moles of the ligand, the amino acid, to 1 mole of the mineral. Their material is 0.6 to 1, so it's not even a proper chelate. Heavy metals is very important. Our products are very low toxicity. So ours is, less than, 0.1 parts per million, where theirs was 3.3. There's no evidence of inorganic purities. Theirs showed an evidence of calcium carbonate, and no evidence of separation of water of the ligand from the metal. Whenever we did a solubility of that material, there was separation of the calcium carbonate from the ligand that they used.
Very interesting.
Yeah. So in conclusion, our calcium, as all of our minerals, has a chemical structure, spectral evidence of it being a true chelate, and then in this case, this competitor showed evidence that the calcium was underreacted calcium carbonate. It was simply blended, small amounts of glycine. It's not a chelate. It's not even a glycinate salt.
We will get this out for you, hopefully by end of business today, if not first thing tomorrow.
We had mentioned some of the toxicity. You got lead content. I know these are naturally occurring minerals in nature. However, some have exceeded some of the lead limits that we should be exposed to.
Well, this is what California allows, 13.4, and they're really big on the Prop 65.
Yes.
Other chelates that we've tested have been higher. All of our heavy metals test well below what the maximum upper limits allowed. So in this case, we're at 0.1 part per million. So it's a very, and this is where it comes into the safety of the product, as well as the LD50s, but also nothing in there that's creating any additional toxicity.
Yeah, because lead is something you build up. So if you're with this one company and you're buying your vitamins at the same place you buy your toaster ovens at Walmart,
right,
and you're getting 3.62 parts per million, doesn't seem like a whole lot until you've been on the product for 3 or 4 years.
Well, it builds up over time. I mean, that's why companies do chelation therapy with sodium EDTA, where they're pulling heavy metals out of the body because there's a toxicity.
Absolutely.
Our method of chelation is
here looks like zinc.
This is zinc. This is another company that we tested for cadmium. Cadmium is another heavy metal. This material was 13.4 parts per million. Our material came in at 0. A lot of it has to do with the starting material. The starting materials that we use, we source throughout the world. We may bring in 20 samples from one company or of one product, like a calcium or a magnesium or a zinc or whatever. We're lucky to find 1 or 2 that meet our specifications. Everything we make is pharmaceutical grade. Internationally, our business in pharma is big, like in Brazil. We do a lot of business down there. And so, that standard carries over to everybody, not just any pharma customers that we deal with.
Yeah, I think it's fantastic that you guys are the world leaders, that we are so fortunate to be working with you. I know yours are the most bioavailable. They're very safe and easy to tolerate. We've had patients on these for long periods of time, including me and my family. Never an issue. We love the fact that it comes with all the testing behind the scenes for the bioavailability, the heavy metal content, the looking at the formula to make sure it's the right active ingredient, and it's really clean. So we really love that. And then the extra bonus is all stability studies and comparing it versus the other nutrients, where you never see them comparing theirs versus yours. I guarantee that.
I don't see anybody out there that's putting the information out that we do on minerals. So what happened with Albion over the years? We've always had to prove that what we make is a legitimate product. So in 1977, we basically sued the FDA to get them to look at our minerals and give us a consent decree. And so since that time, the FDA has sponsored our minerals, particularly Ferrochel, more predominantly in food fortification around the world, because a lot of the kids in developing second, third world countries they're anemic, they have iron deficiency. And our Ferrochel is used in dairy products like yogurts and milks. It's used in baked goods. It's used in things like cookies and breads. And that's really the only way you can get nutrition, based on economic factors in these other countries around the world.
Fantastic. I like it that you guys don't roll over to the FDA, right, Greg?
So in summary, other companies, will cite our research in promoting their products. We make amino acid chelates that guarantee absorption and bioavailability. We've proven our proprietary brand that chelates are safe, and we've proven that these chelates are effective.
Well, it's fantastic. We really appreciate you making time for us. I learned so much today, and we're going to use this as part of our training. And thanks so much, Rick. We really appreciate all the support, and we're looking forward to continuing to grow with you and your company before you retire onto that fishing boat. So we got to squeeze all the education we can. And I'm going to take you up. Was there an offer, Phil? I thought he offered to take me fishing. So if there was, I would invite myself. I bring the beer and the bait. So
I don't use bait. I throw lures. So you're gonna have to get your shoulder in shape.
Well, thanks so much, Rick. I appreciate all the support. Have a great day, buddy.
Jamie, take care.